Amid the coronavirus's devastation, California has increasingly been touted as a model of decisive action. The state's early stay-at-home order saved countless lives. But what about the 150,000 Californians who have no homes? Although Governor Gavin Newsom announced that the state would provide 15,000 hotel and motel rooms for unsheltered residents, almost a month later, only about a third of those rooms have been filled. The vast majority of homeless people are where they were before the outbreak began. Congregate shelters are the perfect habitat for the virus to spread, and encampments still line the streets.
I'm getting ready to go outside of my RV into the camp. Right now I'm out of masks, so I have to use a scarf to cover my face because they don't provide those here. But I'll give you guys a little bit of a sneak peek of, how it is out here. Here goes nothing.
While the state isn't currently collecting data on how the coronavirus is impacting homeless people, here, Californians in different circumstances share their stories of surviving a pandemic while homeless.
I've been here for 4 years, going on 5. And it's been a good place to stay. We have rules we follow around here. Nobody drinks and nobody smokes.
Kent Dole, a 64-year-old resident of the Here There camp, lives along a busy street in Berkeley, California.
I eat my meals. I don't have a microwave or nothing in here. There's no amenities or electricity usage. Yeah, I've got Parkinson's disease for the past 16 years. 16 years of rehabilitation. It's taking its toll on me now that I'm getting older. I've never seen anything like this in my lifetime in this Bay Area. So we had to close things down, close down the city. So I'm not really worried about it. I know the symptoms, I know the protections, and I go with them every day.
As for Newsom's plan, those state-rented rooms are not for everyone. Only those who've tested positive for the coronavirus or who are at a heightened risk of contracting it. The state can only seek reimbursement from the Trump administration in those cases. And the state says it's keeping many of those rooms empty in case there's a surge of homeless people with the virus.
Severe winter, they're getting homeless in hotels. If it's a hot summer, they get homeless in hotels. Well, it shouldn't take this kind of an event to get people into hotels or homes, especially the most vulnerable. I mean, I didn't ever want to be vulnerable or sick, but I am.
If homeless people living outdoors show no symptoms of the virus and state and local authorities can't offer them private rooms, federal health experts say the best option is to leave them where they are. Moving them to shelters just risks spreading the virus.
They have marks at the front desk because we have to check in between 2 and 4, and also downstairs in the basement where we have our cafeteria. They have marks for, like standing in line at least 4 to 6 feet apart from each other. Other than that, literally at those 3 places is the only time that happens. I feel like they might be trying, but it's not really too much you can do in a shelter setting.
Ambrose Holyfield has lived in the next-door shelter in San Francisco for several months. Shelters are notoriously crowded, and some even housed residents in bunk beds. As awareness of the coronavirus danger grew and outbreaks erupted within shelters, a new question emerged: how to expand the shelter's capacity without turning them into potential death traps for the poor.
They have recently moved all of the clients that are 60 and over to hotels, so there's a lot more space. They've separated everybody on the floor quite a bit. There's at least 2 or 3 bed spaces in between most of us now. I actually have a whole section of the floor to myself almost. But before they started moving out all the more elderly or sickly people, social distancing did not exist. Living in the shelter is kind of hectic because at this time, with the rules that they have implemented as far as, time limits on being able to go outside because they're trying to cut down on spreading the virus, that part is a little hectic. I believe there's a lot of cabin fever syndrome going on. Most people, they stop them before they even get to the door. Where are you going? You're going to smoke? You got 10 minutes. If you're not back in 10 minutes, you have to have a mask on when you come back in. If you don't, we got to kick you out. If you're going on an errand run or if you're going to an appointment, you got 1 to 2 hours. If you're not back within that time, they're trying to drop people's beds, which I think is terrible because there's literally no shelter taking anyone in. They're not making any more reservations for anybody. If you're outside now, at this point, you're just outside.
Okay, as you can see, we have all these trailers out here. I mean, this is just a little bit of them. I keep myself safe in my own house by hand sanitizer bottles everywhere.
Ashley Hammond lives in a government-sponsored RV park in Oakland, California. A state grant covers electricity, drinking water, shower services, and other costs.
They came today and they cleaned the porta potties, but they're still disgusting to me. This one's not so bad on the inside. But we use a hand washing station here, but there's no soap. No soap. No soap on the other side either. See? Someone will contract the virus here. I'm surprised someone hasn't already. It's only a matter of time. The only thing I can do to keep myself safe while I'm out is covering my face, wearing gloves. I have hand sanitizer bottles all over my house. And I try to keep myself inside as much as possible because I don't want to get sick or have my kids get sick or my mom get sick.
Having running water is like such a gift. Also Wi-Fi and electricity, because those are things you only have in a housing kind of situation. You don't even get as much access in a shelter. Everything is shared. Are you hungry? You gotta give me 5 on the other side. Good job.
Sandy Mikowski moved into a state-funded hotel room in San Diego, California, after experiencing COVID-19 symptoms.
So I just got a call from hotel staff that they have to shut the water off for maintenance today, right as I was about to start my morning routine. I used this method when I was in my car. Lived in my car for 2 years before it got impounded. And even when I lived at the shelter in my bunk, because we had 3 sinks for 80 women, that doesn't go very well. And look, I have a little toothbrush holder. That's a cool thing to have. That's like being normal again.
California's new normal is swiftly approaching and still not clear. There's little agreement in the state about whether all homeless people should be placed in private rooms, and if so, who pays? Theoretically, San Francisco's city attorney says the city has the right to commandeer vacant rooms, of which there are tens of thousands, to house homeless people in a pandemic. Newsom has the same power, but hasn't gone that far.
And so we have organized with Motel 6 some language that would allow that process to take shape, make it much easier beyond this pandemic to potentially consider these sites as a broader portfolio to provide some more permanency for those most in need.
Meanwhile, for many, the search for housing is as elusive as ever.
I signed up for email alerts from like the Dahlia housing lottery. I won a studio apartment, really nice studio apartment on 38 Harriet. And as soon as I won and began the application process, the lockdown started.
Now, Amber's Holyfield's application is on hold indefinitely. Learn more about California's response to COVID-19 at calmatters.org. For CalMatters, I'm Beronda Lyons.